everyone. My name is Nicole Richter. I'm a training and compliance specialist here at Medina County Board of DD. So welcome. Welcome to everybody who's joining us online today. Today we're joined by Teresa and Megan from the health department. We're going to talk about reportable communicable diseases. So if you have a question for anybody who's in person today, you can just let me know. I'll bring the mic over so you can, so we can let everybody online hear what your question is. And then anybody joining us online, go ahead and put your question in the Q&A. We will get that answered for you. And I think that's it. I'm going to turn it over to Teresa and Megan now.
All right, thank you.
Hello. Well, welcome everybody. My name is Teresa McMillan. I'm a public health nurse with Medina County Health Department. My focus is communicable disease, which is infectious disease, and that's what we've been asked to speak to you about today. In terms of communicable disease is another way of saying infectious disease, and our goals for today are going to be very simple. We're going to talk about what is communicable disease and what is infectious disease, how you protect yourself, how you protect other people, and what you should do if you see increased numbers of cases of any kind of illness where you're at. And then we're going to talk a little bit about one of the best ways to prevent any kind of infectious disease is hand washing. And then we're going to leave a little bit of time for questions at the end. So if anybody has any questions, Megan and I have very casual conversational style presentations. We welcome your questions. So if you have any questions at any time, just throw up your hand and we'll answer them. If it requires a longer answer, we may defer that towards the end of the program. But we do welcome your questions, and we want to make this presentation as enjoyable as possible. So again, my name is Teresa McMillan. I'm a public health RN with a focus in communicable disease.
Yeah. And my name's Megan Dean. I am not Missy Pippa. I mean, she just had such a good photo, so I just decided to leave it up there. No, she stood in for me last week. Graciously, so I just didn't get a chance to switch that over, but I am me. That is Missy. I'm a communicable disease investigator. So at the health department, one of the things that I do, I work with our public health nurses, and if somebody calls in saying, hey, it might be a school that has 2 or 3 cases of people with fever, or sending kids home because they're not feeling well, I'm one of the people that you might get to talk to, and we kind of help you out with a lot of different resources we can bring to the table, and kind of maybe help track like where it might be coming from. And so the biggest reason is so that we can then prevent it from continuing. That's the goal here. And like Teresa said, hand washing is a great tool. Sounds simple, but it is a great tool to use.
Absolutely. Simple but very effective. So if we are too soft, which we've never
been accused
ever, if we're too soft, the audience here just go up, let us know. And if we're too loud, just give us a sign that we're a little too loud, and we'll tone it down a little bit. We do have resources here, and we will be referencing them during the presentation. If anyone who is watching this via the stream would like some of this information, that can contact us at the Medina County Health Department. We'll make sure, and we'll leave copies here as well. So if anyone's interested, they can get copies of the materials that we have. So to begin, what is communicable disease? What you need to know. In terms of, like I already mentioned, communicable disease is another way of saying infectious disease. And infectious disease is diseases that are caused by a germ or a microorganism. And depending upon the type of infection, they can spread from person to person or from a source to people. Now, you can be affected with different kinds of organisms like bacteria or viruses. There's a large number, and infections are very good at spreading. And that's one of the things we'll talk about. They're designed to spread, but there are ways you can stop them from spreading in your particular environments. And that would be it. Next slide.
And anytime you have large, not even large, but groups of people together, there's a chance to see this increase in communicable disease. It's just the nature of how they do their job.
You can be as careful as possible, and we're going to advise different ways that you can limit the spread. But wherever you have people, you're going to have the risk for infectious disease. Right. That's just part of the thing. Where you have people living closer together, that's going to be more of a risk. So what causes the infections? In a word, germs. And germs is a nice little catch-all phrase that can mean a number of different things. It can mean bacterias. It can mean fungi or funguses. It can mean viruses, parasites, mites. Generally, infectious organisms are tiny. They're microscopic. You're not going to see them. You're not going to know they were there. The two most common that we think about more often is bacteria or viruses. Bacteria, strep throat, viruses, of course, COVID and flu. Now, this is one thing we're going to talk about today. I'm not sure if you guys are aware, but our state, our nation, and definitely our county are going through a large increase in flu right now. So we're going to talk a lot about that. We'll talk a little bit about some of the methods that we talk about preventing illness will help you with this current flu outbreak that we have. But something to think about in terms of knowing what your infection is, we're going to stress during this presentation that you should really make sure that if you know somebody who is showing symptoms of illness, that they go to a doctor and they have themselves checked out. Because, and here's why it's appropriate, is that if somebody has an infection with a virus, you can get them antibiotics and it's not going to help them. And if someone has antibiotics, but you don't give them an antiviral, same thing, it's not going to help them. So that's why we stress if you know someone who's sick or symptomatic, have them see their doctor, because it's important to get the right treatment at the right time. With antivirals, if you have a viral infection, antivirals, if you don't give them in the first couple of days, they're not going to work. So again, with infection, make certain if somebody's showing symptoms that they get themselves checked out so they can make certain to get the appropriate treatment early in the illness. Now, infectious diseases can spread many different ways. So sometimes we know right away something made us sick, right? Like you eat, say you have a bad burrito. You got a burrito, you started feeling sick right away. You're like, oh, I know it was that burrito. But a lot of times you don't know, and you can't know because as we talked about, these are microscopic organisms. You're not going to see them, but they're there. So some of the most common ways that it can spread, again, we think of with flu, coughing, sneezing, COVID, another one, coughing, respiratory particles. When you cough, they stay in the air, and you can breathe those in and become ill yourself from people coughing, sneezing, breathing it in. So one of the most, and I know we all think COVID and flu, but one of the most contagious things is measles. And unfortunately, measles is making a comeback in the country. Measles is so infectious through this route of through the air. If someone with measles goes into a room with 10 people and they cough, 9 of those people will get sick with measles because it is that infectious. So that's a very common way for illness to spread. Another common way for illness to spread is through touching contaminated surfaces. And something to think about with this one is it can work a couple of different ways. For example, if someone has norovirus, you guys heard of norovirus? Norovirus?
Yeah, that's a yes.
Yeah. I'm sorry. Yes, I wish I had that.
Please tell me more.
Norovirus is a GI illness, non-dominant, really strong, makes you very sick, short period of time, but during that period of time, you're miserable, and it spreads rapidly. And fun fact here, norovirus, I don't know if you guys are actually aware, Norwalk, Ohio.
Hey, look at it.
Diagnosed. First discovered in Norwalk, Ohio in the late 60s, and it used to be called the Norwalk virus. And I think Norwalk got tired of that.
I mean, why would?
It's called norovirus.
It's not really something they want to be known
No,
for.
you don't want to be known for this. So through touch, norovirus, when someone is sick with norovirus, they touch surfaces, they contaminate those surfaces, especially bathroom surfaces, shared surfaces. Then someone else touches those surfaces and they touch their mouth, their eyes, they eat something, they drink something, they become ill. And it transmits rapidly through this route, very quickly. So you want to make certain when people are sick with, say, norovirus, that you're sanitizing those shared surfaces that everybody touches.
Often.
Often. So for example, in this building, you're touching the same surfaces, doorknobs, light switches, tabletops, coffee pot handles, things you're touching a lot. When there's a lot of illness in your community, like there is now with flu and with noro is very high right now as well. You want to make certain those shared surfaces are cleaned and sanitized because of that risk of transmission. So touch another way, it can be, for example, a different kind of illness, flu. Got a lot of flu right now. We know you can spread flu through the air, but you can also spread it through contact with contaminated surfaces. So if you have a lot of people that you're in a home, excuse me, in a home or a place where they're close together, then you want to keep those shared surfaces clean. Because when you're touching those contaminated surfaces and you wipe your eyes, you wipe your mouth, you're going to become very ill. And quickly too, because flu spreads very quickly.
And we don't realize how many times we touch our face. Well, you might now, at least for like a short period of time, but it's just autopilot.
Right.
You know, how many times, like if you go out to a restaurant and you look at the menu and you touch the menu, how many other people have touched that menu? You know, things like that is why this can spread so quickly, so easily to different groups of people.
Right. And exactly, they give you the menu, they take it, they bring you bread. What do? Eat the bread. You're not washing your hands again after you touch the menu.
Yeah.
So one thing you might want to think about, hand washing, we're going to talk about
Yeah.
the best way, but another good way if you don't have access to a quick hand washing is have some hand sanitizer with you.
It won't kill everything, but it will
Right.
kill. It kills like 99%. But
It kills a lot, yeah, but it doesn't,
Yeah.
you're right, it doesn't kill
Yeah.
everything. So that's why hand washing is still very good. But my husband, whenever we go out to eat now and he gets the menu, he just goes like this because he knows it's going to be like, here's your hand sanitizer.
my family knows that I just sit there and I don't touch it. I was like, I'll look over your shoulder. I want that.
So another way to do it, we have up here through eating or drinking. So eating or drinking of something that was contaminated. So say, for example, you ate something that wasn't thoroughly cooked. Chicken's a good example. Chicken actually has a lot of bacteria in it. When you cook it, then it no longer kills the bacteria. But sometimes you might get food, say, prepared for you that's not fully cooked. And you could pick up salmonella, which is a bacteria. And that can make you very sick very quickly. Or if it wasn't stored properly. Has anybody been to like potlucks during the summer or graduation parties and they have like the dairy dip sitting out in the sun, you know?
We're not trying to ruin gatherings for you.
We kind of have that effect. Don't even get us started on buffets. So what we're trying to say is this. There's different ways you can become ill through touch, through eating or drinking. Another way through eating or drinking that you can become ill is something called the fecal oral route, which I know sounds gross because it is.
It is gross.
It is gross. What it means is you ate or drank something that was contaminated with a small amount of poop. You didn't know it was there. You certainly wouldn't have put it in your mouth if you knew it was there. It's microscopic. You're not going to see it. You're not going to smell it, but it's present. That's why we definitely say, be careful. Make sure your food is cooked thoroughly. The different ways this route can work, the fecal oral route, say you're at a restaurant, and I don't mean to pick on restaurants here. Say you're at a restaurant and you go to the bathroom. The person in front of you was sick, didn't wash their hands super well. They touched the doorknob, they touched the faucet handles. You go in there, you touch that, maybe you didn't wash your hands super well, then you go out and you eat something. That's one way you can become ill. Or someone who has an illness makes your food and you eat that food. Another way that you might hear about it a lot of times is everybody hear about the recalls of, romaine lettuce or greens or things like that. Those are usually greens that are grown somewhere where the field is irrigated with water that has poop in it. And so what happens is if you eat that salad, you didn't wash your lettuce very well, you get sick. So as you can see, there's different ways that can spread illness. And infections are very good at spreading.
And one of the things why we keep going back to hand washing, that's something we can control. We can't control the other person that maybe doesn't wash their hands and touches the things that we're going to come along and eventually touch. But if that's the one barrier we can put between us and some of these germs to really dramatically reduce our risks.
Absolutely. We don't want you so scared that you're afraid to leave your house without a hazmat suit on. But we want you to be caught.
Or ever go out to a restaurant again.
We're not trying to put you off restaurants, but as Megan said, hand washing is something you can control.
Yeah. So risks of illness, we've touched on some of these. Frequent touching. Either touching of your own face, touching of other people, close contacts, not washing hands. We've said it probably 5 times already, but we're probably going to get closer to 15 by the time we're done. And if you have certain health conditions that put you at an immune deficiency, you might be more at risk. We could both be at a place, and if I have something that makes me more at risk and we're around the same person, I might get sick and she might not because her immune system can fight it off. So that is one of the things that can increase our risk of illness. One thing that helps to decrease, vaccinations do help. And if you need assistance with that, you can give us a call. We come out, we do clinics, we can help with vaccinations. Hand washing, source control. I like this part because who wants to get sneezed on? Show of hands. Yeah, no, not a good day, right? So source control is just a way, when we say the fancy term, it's like, okay, what's that mean? This is a way, like masking is one way of source control. Like if I'm sick, I'm going to put a mask on so that I don't sneeze on other people or put others at risk. It's to, I've already gone down, so it's to keep it just in me and not, take it to others.
Right, because you can't always know when you're going to cough or sneeze. I mean, so again, cough or sneeze into your elbow if you know it's coming, but sometimes you don't know when it's coming and you've just aerosolized all that bacteria or virus that you have. So
Yeah.
source control.
A couple weeks ago, actually, Missy stood in my place last week because I wasn't feeling well. When I went to the clinic to see a provider, or a clinic, not the clinic, I guess I should say, to see a provider, I was, had my source control on, and I watched this, I would guess, 19, 20-year-old come in with his dad. Dad put on a mask, and the younger gentleman, 19 or 20, was like berating his father. You don't, like, why are you wearing that? Like, you're not even sick. And I'm thinking, don't you shame your father. And he shamed him enough to take it off. And all the people in this waiting room are coughing. And I'm like, he is trying to protect himself. So source control can also be for you just trying to protect yourself. Teresa said our numbers are really high for flu, for
Extremely
COVID,
high.
for noro right now. We have not just outbreaks, but the numbers are just high.
Can I interject here real quick? If you are interested in what the numbers are actually like in our community, you can go on to our website, the Medina County Health Department, and you look under community and data reports. And in there, there's a flu dashboard, and you'll see over the 5-year average in gray, and that's kind of just, it's around the time where there's flu. So there's a 5-year average around here. Right now, we're like this. The line was almost vertical 2 weeks ago. So it's out there. So the information that we're giving you today is actually information you can use to help yourself.
I know a lot of people got burnt out with masking with COVID, but there are times we need to break that back out just to protect ourselves and others. Isolation can kind of fall under source control, and it's more up there just as a word to get us to, it's a harsh word. Nobody wants to isolate, and we don't want to isolate others. But for a short period of time, maybe like separating people as much as we can, as the best that we can. It might not be perfect all the time, but the more little barriers you put in place, the more likely it is that we're going to catch those germs and it's not going to get through to that person. So keep it as a tool, and if it can't be perfect, if you can't put somebody, isolated alone, do the best that you can. Something is better than nothing, is a way to look at it.
And there is guidance regarding isolation. Some illnesses, some infectious disease have Ohio law
Yes.
that say you have to be isolated for a certain period of time while you're infectious. Some of them have law regarding when people can return to work or school. All that information is available online. We do have here, we've given out some of these, and they are available for free online. We have a slide that'll show you later how to get them. But there's a chart on the Ohio Communicable Disease chart. And I know people at home can't see this, but it is, like I said, available for free online. And in that, it lists all the information regarding a variety of illnesses.
They also have a PDF online.
They do, which is much easier to look at. This is very tiny. But what they have in here is information regarding a number of illnesses, and it talks about what the isolation requirements are, if there are any, and it gives you recommendations, regarding how you can prevent, and if somebody needs to have certain conditions met before they come back to work or school.
Right. And so basically, staying home when we're sick is important, and encouraging others to stay home when you're sick. I was just at a couple schools this morning helping with one of the roles that we do is to go out and just kind of look and validate some data that they turn in to the state. And I always ask, so you have a lot of stuff going around, and like, oh, well, up until they had a nice little 4-day weekend, and they're like, up until that, luckily, knocking on wood, luckily nothing has come back. But before that, I was sending like 3 people home every day because she's like, parents think that just because somebody doesn't have a fever, they can send their kids to school. That's not always the case. A little bit of good judgment comes in. So fever and chills, yes, are on there, but you might not catch the fever part. Somebody might feel chilled and not really know how to communicate that. They just feel run down and really kind of crappy. They feel like maybe a bus hit them. If you've ever had that phrase come out of your mouth, you know what I'm saying. Like when you feel it, you know it. They might have a cough, those muscle and body aches. So the best thing is rest. That is your body like screaming, you need to stop, or I'm going to force you to stop. And sometimes we ignore that, and then our body forces us. It's like, nope, you're done. So the best thing is drinking those fluids, really replenishing fluids, because we don't realize just with chills how much that we're expending internally.
One thing we should talk about too, in terms of when people, a lot of illnesses, infections from bacteria, say you can go back to work after you've been on antibiotics for 24 hours, which is good advice. But sometimes people, if they have a fever, it's the same thing. They can't go back until 24 hours after that fever has resolved. So what does that mean? Fever is resolved. I've done school nursing. I've had people send their kids to school. They have no fever. Well, they gave them Tylenol before they went to school, so they magically have no fever. That's not what we're talking about here.
Right.
Your fever has been resolved for 24 hours without the use of any medicine. And the same thing for vomiting or diarrhea. That vomiting or diarrhea has resolved for 24 hours before or without the use of Lomotil or some sort of medication to treat that. Because what you don't want is to send people back to school, to work, while they're still actively infectious.
Right. Very good. All right. So, go ahead.
When in doubt, call the Medina County Health Department. That big chart that I showed you that was too tiny to look at, we have all that information. If you guys have any questions, or you're not sure, or you know somebody, or your child is sick, or your family member is sick, give us a call. That's what we're here for. We have that information, and we have the resources to help you. So, for example, say, we've talked about how when people live close together, especially things like group homes, nursing homes, assisted living facilities, these are all places where people can spread easily. Schools, because kids are close together. These are the areas where illness can transmit. So if we do everything right and people still get sick, what can we do about that? So we'll talk about what kind of questions, if you do have questions, you give us a call, what sort of things we might ask. So we're going to ask you questions like the number of cases. So if you have a group home or a facility, how many cases are there? And this is important to know because it helps give us an idea of what kind of illness we might be dealing with. Also, do they all work at the same place? So say, for example, is this one location where people live? Or is this a work environment where people come from lots of different places and they all are in this work environment? That changes, what we're looking at. Knowing this can help us determine how that infection is spreading, if we know common places where people are becoming ill. So what are the symptoms? Again, very important because this helps us identify what this might be that we're dealing with. In terms of symptoms, also things to know, like if someone's coughing, we can talk a lot about resources that can prevent spread. So think what we call mitigation, which is a fancy word that just means what are you doing to keep that from spreading more. So we'll talk about, source control and keeping things clean, and we have information and resources that you can give people in the community, parents and families, so that they can understand what this illness might be and how they can prevent it and keep it from spreading further. So again, identifying the patterns of who got sick does help us get to the bottom of what could be causing this increase in cases. So sometimes when you have a number of cases, it becomes reportable. And a reportable infectious disease in Ohio, a reportable infectious disease is one that can cause spread. And so it's been identified as being reportable. And what this just means is it's an infectious disease that the Ohio Department of Health has identified as one that when somebody gets a positive lab result, could you pass this out?
Sure.
Positive lab result, The lab is actually required by law to notify the health department in the jurisdiction in which the person lives. We keep their information completely confidential. And this list is available online. It's Know Your ABCs, a guide to reportable infectious disease in Ohio. So if you ever wonder if you have cases around you, if they are reportable, it's on this list. And this list is broken down real quickly into class A, B, and C. Most illnesses are under class B. That's your most standard illnesses. Class A, those are the ones we never want, knock on wood, things like measles, anthrax, that sort of thing. Class B is where most illnesses are, like chicken pox, salmonella, pertussis, things like that. Now, Class C, I want to draw your attention to this. Class C just doesn't have any specific name of an illness, but it says in cases of increased numbers. So say, for example, norovirus. Norovirus is not reportable, but if you have a number of cases at your facility or school, then it becomes reportable. And the reason for that is because they want someone to report it so that we can follow up with them and give information and resources to the facility to prevent continuous spread. So that's why these things are reportable. We're not trying to be nosy. We're not trying to get into anyone's business. We're just trying to help you prevent that spread from continuing. Because as we've talked about, when people are together, things are very easy to spread. Yes?
Yes.
Yes. Yeah. COVID is not, if you're looking for COVID, it's not on this particular list. And the reason the Ohio Department of Health kept that off is because it's changed its classification. It was originally an A, now it's a B, and they're looking at turning this into something that's only reportable when there's a hospitalization involved. So if you have any questions about how you should handle any cases that you are aware of, give us a call at the health department. We have that information and those resources to help you. Thank you, Pam.
Yeah.
Excellent question.
But for right now, it still is a B.
It's still a Class B
Yeah.
right now, but it's probably going to change soon, I would think. They've been talking about it for a while. For example, with these sort of reportable ones, we do, like I stressed, we do keep people's information confidential. We're not trying to be nosy, but a nurse like myself will give you a call and we'll ask, those kind of questions that we talked about. And the reason this is important is to prevent that spread. What happens in the small groups affects the larger community. And it actually goes the other way too. What happens in the large groups affects the smaller groups of people as well. So we want to protect everyone. We don't want to be nosy. We're here to help. We have the information. So we talked about the knowing your ABCs. If you have any questions on this, throw up your hand. So we're going to talk now about when something is reportable. There's a resource for that.
Maybe that's well, hold on, Teresa. Do we have any questions online? Is that a good place to? Oh, you're fine.
No questions online.
Okay.
I did share that document too.
Oh, perfect.
Excellent.
Yeah, thank you.
Thank you. So the Infectious Disease Control Manual, I'm not going to spend a whole lot of time talking about this right now. It's a resource available to you. So if you do have those increases of illness at your facility, your school, places where your kids are, places where you are, just know there is a resource available to help. If you call us, we will access this and give you good information that will help you identify what might be going on in your facility and how to stop it. We also have lots of resources for that. So one of the things we stress is you can't know it all. In nursing school, for example, we learn this. You're not going to know everything, but you need to know where your resources are. So don't feel alone. If you have a number of increased cases, you're concerned, you're not sure what to do, give us a call because we have the resources that can help. Nobody can know it all. So there's 2 different kinds under the Infectious Disease Control Manual. Again, just give us a call. We'll help you with this. There's one for Section 3, which is all those reportable ones that I showed you on this. They're all on there. Now, Section 6, those are the non-reportable ones, and that information is on there too. And what I want to stress for your information, these resources are available online, and they often have a fact sheet that goes with them, a downloadable fact sheet. So say you have illness at your facility, and you want to give information to your parents, your families, or you just want the information for yourself, these fact sheets are available, easily downloadable. We can get them to you, or they're available online in the Infectious Disease Control Manual. And you can disseminate those, give those out to whomever you need. Again, we're here to help, and we do keep everybody's information confidential.
All right, so we kind of touched on this a little bit, but for some of those, even in cases where something might be not reportable, not on that list, could still end up being an outbreak. Outbreaks, the definition is very vague on purpose, but it's more cases of a disease than what you're expecting. So if we actually go into specific diseases like Nora, there she is.
Sorry.
We've mentioned before, influenza, even COVID. Well, COVID's actually a little bit more strict right now, but for like noro and influenza, it's 2 cases would be considered an outbreak.
When in doubt, give us a call.
Yeah.
We can help you out.
Go back to that other slide of when to call us. Anytime you have questions. For COVID, for a congregate living facility or group home, long-term care facility, it's 1 positive case in a client or a resident, or 2 staff members would be an outbreak, or 1 in 1. Lots of fun numbers to try to keep straight in your head, which is why if there's ever any question, just give us a call. I mean, the outbreak investigation that we do is nothing is ever punitive. It's to help you, because we know that you guys care about your clients. It's to help you help them. That's really, it's trying to prevent that continual spread. So when in doubt, call and we can kind of jump through all the red tape and jargon for you.
Right. And we can let you know if there's any Ohio law regarding that too. Like I said, there's Ohio law regarding some illnesses. Not a lot, but it is out there, and that resource is available to you, and we can give you that information.
Okay. All right. So now to hand washing. Have you ever seen any of these things happen? Maybe not just public restroom, but just in a public facility. People just use water. Just quickly use water. Maybe the soap is out. Actually, a couple of years ago, we were traveling to a travel baseball game, pulled off at a rest area, and they were fixing the soap dispensers, but they kept the bathrooms open. And I'm thinking, there were no soap dispensers in the bathrooms. I'm like, oh dear. How many people are stopping at this rest area and doing what they need to do and just getting back in their car? Maybe people don't scrub their hands. They don't do the rub part. Taking phones into restrooms because, why not? Washing for a few seconds. Any idea how long you should wash your hands? Oh, that was just cruel. She wiped her phone on you. Yeah.
20 seconds.
Yeah. So there is some benefit that happens at 15 seconds, although that's never been recommended. 20 seconds is where we've landed on the recommendation. And you have optimal germ removal, if you will, at 30 seconds. So keep that in mind. Oh, I thought you were
No,
going
I was
to say
just going to say,
Yeah.
the worst thing at all is seeing somebody walk in, you go into the bathroom, they walk in, they do their business, they walk straight back out,
Yeah.
touching everything.
Yeah.
So we don't want you to do that. We don't want the people you know or cared about to do that, because as we've talked about, hand washing is one of the most effective, easiest ways to prevent a lot of this illness that we've talked about.
So, and I'm glad we are after lunch, because some of these facts are not fun. 80% of communicable disease can be spread from person to person. Teresa already touched on that. Less than 75% of women wash their hands after using the restroom. Sorry, guys, less than 50% of guys. Right. Yeah, didn't your heart just sink a little? Mm-hmm. One interesting fact, I do find this interesting because I think it's one piece or one step that gets often overlooked. People not drying their hands. Damp hands can continue to spread disease much quicker and easier. So keep that in mind. And the sinks in the public restrooms are, when they've swabbed them and then gone under a microscope to look at them, not just sinks, it's actually credit cards, your phones. Cell phones are really bad. when they've done some of those little swabbing tests. But
Oh.
they're covered at 90% are covered in germs.
Absolutely.
Yeah, you're gonna.
They've checked in hotel rooms.
Oh
Anybody-
yes.
They check and they swab in hotel rooms too to see, and they'll put them in petri dishes to see what grows. What do you think the most common, most germy item in a hotel room is? The remote.
Yes.
Yeah, absolutely right. The remote control. So I have one of my colleagues in infectious disease. Whenever she goes to a hotel, she brings those Ziploc bags. She puts the remote in the Ziploc bag. She doesn't want to touch it. She
Yeah.
wraps that up. So yes, surfaces, again, we're not trying to make you afraid of all these surfaces. We just want you to bear in mind if you're touching stuff that everybody's touching, wash your hands, or at the very least, don't touch your face right after you're touching these
Yeah.
things.
And then probably the grossest fact, the bacteria, fecal matter, which is distributed in a fine mist after somebody uses a toilet, does not have a lid, hangs out in the air for up to 2 hours, waiting to land on the next person that walks into that restroom. Who's hungry? I always say it's a good day when you don't get somebody else's poop in your mouth. That is excellent. That's actually a very good recommendation, is to have some type of, right. Now I will follow that up by saying most of the mist is harmless and our bodies can fight that off. But it's really catchy, doesn't it? I got your attention. All right, so the good news is we can actually help keep ourselves safe. We can wash our hands. Some of our numbers up here, we can reduce diarrheal disease by 50%, respiratory illness by 20, and then foodborne illness, which noro is actually also a foodborne illness because you usually have somebody that doesn't wash their hands, prepare the food, and then now it's a foodborne. So that can be reduced by 30%. And like we said, that 20 seconds is that magic number that we've landed on. If you want extra protection, you go 30, which is like singing the ABCs once, happy birthday twice in your head. But as I try
The
to,
last week they were talking Twinkle Twinkle Little Star.
yes,
I believe I heard.
but you can't like speed through it. It can't be a speed song.
No.
Or just count to 30 or 20.
We recommend you do it in your head, but if you want to do it out loud, you do you.
Yeah.
So
Hey, maybe it'll inspire the next person to wash their hands. And then people that wash their hands are get sick less. I mean, that's
Right.
proof is in the pudding there. All right. So when should we wash? Well, anytime where they're visibly dirty, even though some of the stuff we're not going to see on our hands. We're not going to see the germs before touching your face, which
it's hard,
is hard
because we all touch our face without thinking about it.
right. Definitely anytime before you eat or before you prepare meals, or touching any of the food ahead of time. After handling trash, I mean, some of these are very common sense, but you never know. Like we need to point it out. After playing outside, that's a common one. Like if for those of you that have kids come in, wash your hands. Try to get them into the habit of saying that because they're just playing in dirt and other stuff. So after bathroom breaks, and then anytime you're coughing, sneezing, things like that.
Blow your nose on a tissue gets kind of damp and gross, wash your hands. Or you've seen people sneeze. I've seen this. People sneeze right in their hand and then they touch a doorknob
Or
don't be that person.
or the
Wash your hands.
reusing of tissues. I love my grandmother, but like, have you ever seen like they'll tuck
tuck 'em in
tissues
there,
in, like, or they'll reuse them, or even hankies. Like I think back, my dad always had a hanky in his pocket. I'm like, now I'm thinking like that was. I don't think that's very good because you're gonna rub your eyes after you.
Absolutely.
Yeah. So things like that. That's when we should wash. Easy steps. There's 5 steps. We want to wet our hands first. Then I'm sorry. I chuckle at my own photos. So why I like to have fun up there. So the pictures of the dogs I enjoyed, and then I also send the germs running.
Yep.
So wet your hands with running water. It really doesn't matter if it's warm or cool water. That part does, it's up to you what you prefer. Lather your hands by rubbing. Okay, this is, I always say, this is your chance to pretend you're on a medical TV show scrubbing in for surgery. We want to make sure to get the tops of our hands too. That's usually a part that goes unnoticed, or like we don't have to like really scrub, but even like fingernails.
Oh, all sorts of debris gets under your fingernails.
Yeah.
So I like that.
So we scrub that for about 20 seconds, get them all lathered up, scrub, sing that happy birthday song, and then we're rinsing and then drying our hands. Now, we could go a little step further. After you've cleaned your hands, you don't really want to touch the dirty faucet or the doorknob. So one thing that might be helpful in public settings, if you have control of this, is to make sure that you're putting a wastebasket by the doorknob and towels that somebody can grab, dry their hands, open the door, and then throw that towel away right there by the doorknob. That is helpful. Seen that some places, but not all places.
And as you mentioned, be sure to turn off the taps with that paper towel,
Yeah.
because we've talked about how dirty those public taps can be.
Just scratched my eye and now I feel gross. All right. We have our two different methods that help teach hand washing. Glowbug uses infrared light. It's used with a glitter. It's a lotion. It doesn't have glitter on it. I'm just wondering why they call it glitter.
They call it glitter bug.
Yeah.
We talked about this last week at the thing, and we're not going to do this one right now, but we do have this, as Megan will talk about it, we do have this available for teaching. We go all
Right.
over the place with this particular thing, because what happens is, as she said, they'll put this on.
Yeah. And then he looks like a little bug. He's very happy. We've gone out to industries to show this for the shop floor.
Yep.
We've gone out to schools, daycares,
Assisted living,
assisted livings.
nursing
you know.
homes, because people are astonished. You put that on your hands, and then we're like, okay, go wash your, you have a little lotion, go wash your hands. So they go wash their hands, and they think, all right, my hands are clean. You put them under there, and it catches any bit of it you didn't get. And it's amazing, amazing where you find it, under your fingernails, between your fingers, places people thought they got, but they didn't. And since hand washing is so key to preventing illness, this is a great tool for teaching people what they need to look out for. So Megan is an awesome teacher. I love doing these with her. We'll go anywhere. Like I said, we've gone to all kinds of places, and people are always amazed. So if you know of anyone who's interested in this sort of training, we can do that.
The other one we call caught red-handed. Couldn't find a picture with red hands. So they have blue paint. But it's using Crayola or a washable paint. What you would do is you'd have somebody put a pair of gloves. Are you going to do it?
We had
Okay.
a volunteer last week.
Oh, all right.
Is feeling like being a volunteer today?
Actually, I've heard your name twice, and the rule is.
All right. All right. Thank you for being a willing volunteer. All right.
Voluntold.
So this little exercise,
Yeah.
you want to
So
explain
you're
here?
going to put on a pair of gloves. And then what Teresa's going to do is we have a couple different colors of paint. Red, because it's caught red-handed. You can use whatever color you like. I mentioned we use Crayola paint because it's washable. If it should get anywhere else, that way, you know, it will wash out. She's going to put a little dab of paint on your gloved hands, like about
Like
the amount of
soap.
soap that you would use.
Like soap. So turn this way.
Yeah, there we go.
All right, open your hands up and close your eyes. I'm going
right.
to put a little bit of paint here, and we're going to count for 20 seconds.
And you're going to pretend to wash your hands, spreading the paint around the gloves.
All right,
Yeah.
ready?
Yeah, you keep
Yep,
your eyes
keep your eyes closed.
Cheating
Yep.
is peeking.
No peeking.
And ready? And go.
It's doing good.
12, 13, 14, 15, 19, and 20.
All right, let's see what we got.
All right. So
Take a
now
look.
the parts on the gloves that
Oh.
aren't covered in the red paint are the parts that you would technically have missed when washing.
Right, so see the thumbs between the fingers, back of the hands, people forget that.
Yeah.
And we're not singling you
No.
out by any means. We all do this. It's just
And-
a great example of seeing how we miss. We think we've got it all, but we don't.
And to let you in on a little secret, if you're doing this with a group of people, you don't give them a lot of paint, because then,
I was afraid I was going to give up.
well,
Yeah,
well,
oh,
you don't
we
give them a
just
lot
gave
of
you a
paint, because
little
then
tiny
it shows
dab.
that, hey,
There you
I
go.
need to wash my hands.
Yeah.
Like, I need to do this better.
All right, so
If you
good
give them
job
too much
here.
paint, it's
Take
going to be
this.
covered.
You got it. All right.
Well,
Great
yes,
job,
thank you.
volunteer. Thank you.
Very simple, easy, teachable things that you can do with people. And like Teresa said, we're happy to come out and do it with a group. The paint one is I think the most fun. Although people have had they really enjoy Glow Bug. All right, any questions?
The other thing we wanted to talk about just briefly, and then we'll entertain questions if you guys have any, is we have resources here available to you. As we talked about, there is quite a bit of flu and norovirus going around in our community right now. I'm sure you guys have heard and have seen. So we have information here for everybody to take with them, fact sheets that you can share with the community and parents and families on RSV, flu, norovirus, and COVID. We also have more of these ABC listings if you would like one for yourself. We have, now one of the things we stressed at the beginning was that everyone should go to see their doctor if they start to feel unwell, so they can identify what kind of illness they have. But not everybody has a medical home. We're not advocating the health department's health center, but if you know someone who doesn't have a medical home, you should always go with who you trust. So if you have a doctor, a medical home that you're familiar and comfortable with, definitely use that one because they know you. They can identify if there's any changes. But if you don't have a medical home or you know someone who doesn't, we do have a health center. I have information on that. And we also have, do they have walk-in? If they have availability, if you walk in and they don't have appointments scheduled, yeah. But we also have a dental center, so if you know someone who needs a dentist, everybody should have a medical home. Everybody should be looked at least once a year. Look under the hood, kick the tires, make sure you're doing okay. So if you have any questions on that, we have resources. Also, new thing for the health department is a community newsletter, which I will leave here too. You can QR code this. You can also go to our website to sign up for this. And this gives you information about things that are happening in our community in terms of health and wellness. And like I mentioned before, with the flu, when we say that levels are elevated right now, we're not kidding. They're the highest they've been since, what was it, 2002?
I think it's higher than the last.
Yeah.
Yeah.
Yeah, the rates are extremely high right now. So all those things we talked about, when you go out in public, make certain you're washing your hands. If you're going someplace where there's gonna be a lot of people crowded together, maybe wear a mask. We're not saying you have to, but that would add protection to you. Or if you're not feeling well, stay home, as she mentioned before, so you're not spreading around. Wear that mask if you're around people so you don't spread it to them. So if you have any questions now, we'll be happy to answer any questions.
Yeah. Oh, the mic. There we go. I forgot.
Question I had was you were referring to diseases. Do you follow the same stats that for like bed bugs or things other than diseases that could be distributed?
Right.
Well, in answer to that question, yeah, that would be considered a Class C. Lice, for example, or bed bugs, they're not an illness by themselves. They're not reportable by themselves. But if you have more cases than you would normally expect, if you're noticing a trend, give us a call because then that sort of thing comes reportable and we can give you information on that. That would be under Section 3 of that infectious disease control manual that I talked about.
Plus, there's other tips we can offer.
Absolutely. We have resources like things like this. For example, if you have a lot of flu where you are at, we have resources. We have all kinds of information about recommendations for how you can reduce that through what sort of products to use for cleaning, because not all cleaning products kill
work
everything.
for everything. Yeah.
We have resources and things that are available to help you. And that's why we want you to call, because what happens is we get calls all the time at the health department. And if we get called too late, then things have really snowballed. And what we would like to do is catch it before it snowballs. Because if there's something happening somewhere and a lot of people are getting sick, chances are someone's going to call us at some point. And it's usually a family member or a parent that will say, hey, there's something going on. Yeah. So,
Yeah.
if you call us before it gets to that, then generally it's easier to manage. We can give you the resources you need and help you through that. The important thing to think about with any of these is there's a chain of infection, whether it's a bacteria, a virus, a scabies, a bed bug, whatever it is. If it can be spread from person to person, if you get it early enough, with the right information, you can break that chain of infection. And that's why we're here to help with that.
A couple of years ago, we did have a long-term care call. They had a visitor coming in that had bed bugs. So one of the things that we just suggested, and this isn't like a complete picture or guidance, but one of the things that was suggested was maybe having, they had like a bin that the person would actually change into when they'd come in to visit their loved one, and they had a set of clean clothes there, and that's what they had to implement because they kept having this. So, I mean, that was just one like split second
Small example.
example.
We get calls on all sorts of illnesses and infections, and we can get you the information you need, but we need to know about it if it happens. Any other questions?
Great.
Okay.
Thank you so much.
Yeah, thank
Our
you.
pleasure. Thanks, guys.
Yeah.
For coming out today. We really appreciate it. I feel like I've been
Touch your face, yeah.
Don't touch your face. Don't touch your face.
This presentation was recorded, so it will be available to watch on our YouTube page, hopefully within a couple of days, so we can get that out to everybody. If there's somebody at your agency or somebody who should watch this presentation, then you can absolutely send it to them. I think that's it. Just thank you for being here today. Thank you for coming. Thank you for joining us online, and have a great rest of the day.
All right.